Prep your content. Hi guys, welcome to today's Wednesday. And as promised, I was going to bring you more information around hair loss, hairline loss and skin. So today I am with my beautiful lady. We met in 2019. I think it was 2019. We were hosting Indalo was hosting a natural hair event, and she was part of the speakers at the panel. She is a dermatologist, so I'm going to hand it to her for her to introduce herself and where she's based and her social media.
Okay. Hello everyone. I'm Dr. Mukansi. I'm a dermatologist based in Midrand. Our practice is at Curewise Medical Center, which is on 5 New Road. We also available on socials.
Yes.
On Instagram, it's Dr. _DERM.
Okay.
And Dr. Muhanyisi Mukansi on Facebook. So yeah, that's us. We do all types of dermatology, medical, cosmetic, pediatric, surgical, and I have quite an interest in hair conditions.
Yes! So I did promise everyone that I was going to bring them more information around hair loss and hairline loss. Because I feel like we are at the point where everyone is just navigating their hair loss and their hairline loss with no much information. So now me as a person that loves everybody that visits our salon and everyone else that follows us on social media, said, let me take this opportunity to research, to do more, to meet up, to suggest treatments, products that people can use. So today we are discussing that with Dr. So guys, I have 4 important questions that I wanted to ask our doctor, which would give us a clear indication or a clear information on what to do, where to go, how to, and to stop us being product junkies. Because I know everyone self-diagnose themselves and then they self-prescribe products for themselves. We end up with a shelf full of products, but nothing is happening. So one of those questions is, why is it important for an individual to go consult a professional above me as a hairstylist? Why is it important?
Okay, for hair loss is just a symptom that can signify a whole lot of other things. It's like when you have a headache,
Yes.
You may be dehydrated. It could be you didn't sleep well. Your eyes can be an issue, nose, teeth, ears, all of that. So hair loss or alopecia is exactly that. It's telling you something is wrong.
Yes.
And it needs to be identified and sorted out.
Okay.
So when we identify hair loss issues or alopecia conditions, right? The first thing we want to know, is the problem the hair strand itself? Is the problem the scalp? And once you identify that, then you start looking into different causes of what can lead to hair loss.
Yes.
So I'll start with the scalp, right? So you may have inflammation into the scalp, which may signify a whole lot of different conditions. I won't even bore you with the names. I think we have a list that's like, over 50 different types of hair loss. Okay. And all those conditions are different. Are treated differently.
Okay.
I may have 5 patients walking through the door right now, and all of them, by the time they leave here, they've got different. It's not the same. This one may be on certain oral medication. This one is so it's never the same. So the most important thing with seeking professional help is to seek the diagnosis. That's what you want. So you want to know why there is that hair loss. Why is the scalp not forming hair anymore? What is going on there? Okay. And some of these conditions, as I assess a patient, because you need to, when a patient arrives, you take history in terms of their hair grooming practices.
Okay, yes.
Diet, hormonal therapy, different types of medication, other medical conditions, a whole lot. So it takes time, and then after that detailed history, you need to assess the scalp.
The scalp now, yes.
So as you assess the scalp, there are tools we use. Sometimes I can make a diagnosis there and there. Okay, depending on the type of hair loss. Sometimes we need to do a biopsy. It happens often, especially where the hair loss is from the scalp. Yes. So once you have that type of hair loss, we need to assess what type of hair loss it is, because like I said, they are all different, treated differently. And two, we want to see the extent of the inflammation and the damage within. And then from there, we plan our treatment, and then we treat. And most of these treatments are quite lengthy. They are long. Like the patient will be on treatment sometimes for years. And sometimes it's not even easy. And here we also rely on people like you, because caring for our hair, especially African hair, is not easy. I've got Afro, but it's not easy. So you find that as we treat this condition, people become impatient now. They want to do certain types of hairstyles, which actually worsens.
I've had customers where I've had to say, no, take a break. And they're like, hi, Sma, I don't want to take a break. Sma, I've got this, I've got that, I need to do. And I'm thinking, no, just take a break. No, let's just wash and treat in that period of time. And they're like, but I've got things in between that period of time. So I know about the impatient part. Like,
so you want people to be patient, because the process takes long. And unfortunately, there are some who walks in, and the damage is so bad that we can't even treat. Some patients, they walk in like, okay, this is too late now. We can't really help. And it's sad when you get there. So you as a hairstylist, because you are the first person, in contact with the customer, the patient, then you can identify some of those things. Some of the very subtle symptoms that people will have would be, whenever I straighten my hair, I burn like crazy. Okay, that's one of the signs that something is not right in your scalp. God has given us a gift of pain for a reason. Because it alerts us to
that something
is wrong.
You need to be alert.
You need to do something. So sometimes it's that. Or sometimes as you braid or whatever you do on the scalp, you see, it's just flakes that are, beyond.
We've had it. I think we have different kinds of flakes that walk inside the salon. Some of them are so bad that we're like, no. Here there's something definitely that's wrong. And you need to go consult. And some of them are like, okay, let's treat now and see how it looks when you come back. But there's like a variety of these flakes.
So pain, flakes, those are symptoms that something could be wrong. And sometimes, when we touch the scalp, it feels boggy. It feels too soft.
Some feels hard.
But usually that would be scarring towards the end. But initially, some of them, as you touch, it just feels swollen and a bit boggy. When you have that, the customer will need to see a dermatologist, and the earlier they do it, the better. Response is better when you see these patients earlier and you start treatment. And some of them will come in, they've got these like pimples like this on their scalp. That's one of the signs that there's something going on that needs medical attention. There's no amount of any product, hair or product that's going to sort that out. You need to see someone. Some come in with pustules, like they're pussy, and that you also, it's a sign. You need to refer someone to a dermatologist who will make an assessment and a diagnosis, and treat.
Yes.
When you get to that stage where hair is gone, sometimes it's a little too late. Okay, so if you can identify the few signs that I've mentioned and attend to it sooner, that is actually better.
Thank you so much, doctor, for answering that question. Guys, it's important to go visit. When I say you must go visit a dermatologist, please, it's not me chasing you out of the salon. No, it's me saying we need to do more than what I can give it to you. So all